What is that?
Sir, first let me introduce you. I will introduce
No, no,
afterwards.
but just I would like to learn how to share na my screen. So after
Sir,
introduction, then you
first
will.
open your. Sure, sure, sir. First open your PowerPoint presentation, sir.
It is open.
Then there will be option at the screen present now. In bottom. In extreme right hand side bottom, present now.
Uh,
Coming with the cursor. When you will
more
click the
option.
present now option, present
There is
now,
a there,
window, second option, present a window. And
yeah,
then we will
window.
select that window. Yeah.
Okay.
And
Uh-huh.
then your PowerPoint presentation will be on the screen. You can go with the full screen mode and it will be
Okay.
visible to everyone. Okay, sir.
Right,
So
right.
we will.
Yeah, you can start now. You can start now.
Yes, sir. Just a minute, sir. Yes.
Yeah.
Yes. Uh, so good afternoon to one and all. It gives me immense pleasure to introduce next technical expert of the 2 days online international conference on COVID-19. Our renowned next technical session speaker is Professor Dr. Sanjay K. Jain, and sir is currently working as a professor and head Department of Pharmaceutical Sciences, Sri Hari Singh Gaur Vidyalaya, Sagar. Sir is currently Dean of School and Engineering Technology, and with the vast 3 decades experience in teaching and research, as well as with couple of years industrial experience, he has published more than 175 research publications in higher impact journals with the total H index of more than 42 and crossover citations is 7,000. He has also written a book with elsewhere and further 14 more book chapter in different reference books. He has one US, one European patent to his credit, and particularly he has filed 3 Indian patents. His main research areas is design and development of various new drug delivery systems for the treatment of diseases associated with GIT and neuro. Recently, he has been conferred with most prestigious India's most prestigious award, Visitors Award 2018 by Honorable President of India, Sri Ramnathji Kovind at Rashtrapati Bhavan, New Delhi, on 2nd of May 2018. Thrice 1992, 2003, and 2006, he has been awarded with the IDMA Award for Best Research Paper. Besides, he has been conferred with prestigious Professor M. L. Khurana Award in the year of 2003. CRS Kepler Pfizer Innovation Award, Best Research Award in Pharmaceutical Technology 2005, Award for Research Excellence by European Institute of Scientific Research Netherlands, and Dr. R. K. Upadhyay International Award Excellence Award in the year of 2012. Professor Jain has particularly guided more than 24 PhD scholars in his journey and majorly 5 funded projects from various government agencies of India. He is a member of editorial board of critical reviews in therapeutic drug area systems, Bagel House, United Kingdom, as well as Bentham Sciences. Brand ambassador. He is also referee of various national and international journals of repute. He is also chairman of University Technical Committee, chairman of Council for Industry, higher education collaboration and member of Board of Studies of various universities. He is a live member of many learned societies and has organized many training programs and conferences. In spite of this all achievements, Sir is a very kind human being, great researcher, great administrator, as well as academician. So now I would like to request to Professor Sanjay K. Jain sir to go with his presentation and can really enlighten our virtual audience with the current updates of COVID-19. Thank you so much, sir.
Uh, Thank you very much for giving a very nice introduction. I think it was not desired at this moment, but anyway, first of all, I would like to thank organizer of this international webinar that is having the theme challenges, COVID-19 challenges uh, in testing and prophylaxis management, right? So
Right, sir.
the theme of this webinar is very befitted with the need of the society, present need of the society. It is really required because if you see the citizens of any country, then they are really having a lot of fear. What will happen? What will be happening? How to protect themselves from this COVID-19? It is really very difficult, and the ISF, especially ISF college of Moga, has selected uh, very good theme. We can say it is a required of the present time. And I'm sure that deliberation of this conference will be beneficial to our participants of this conference, and they will disperse this knowledge to the society also. They will take this knowledge and then they disperse this knowledge to the society. So, well, I received this call a long time back, but I forgot in between. I have to deliver a lecture in this conference. But yesterday I received a phone from Professor G.D. Gupta, and he said that, sir, tomorrow is your lecture. I said, oh, tomorrow I'm having lecture. Oh, sorry. Then I started searching what I supposed to tell with our participants, right? Then I decided I should deliver lecture on challenges for pharmacists in present and post-pandemic COVID-19. And just I'm sharing my screen. Just a minute. Okay. Are you able to see my this screen? Participants are anyone can respond. Are you able to
Yes,
see
sir.
this? Yes, it is visible.
Yes, sir.
Okay, okay. So that the title of my speech is Challenges for Pharmacists in the Present and Post-Pandemic COVID-19. And we'll start our presentation with the history of the viruses. Since long time we are listening about the viruses and how they are affecting the society and life of the human beings. Thousands of viruses are spread all over the globe, and some of the epidemic and some of the pandemic. This the word pandemic we listen first time. Then when we come across with the coronavirus 2, novel coronavirus 2, it is really pandemic because it has affected 216 countries. It's spread over 216 countries. Can you imagine how many people are affected by this coronavirus? So if you see the history of the virus, first virus came into existence in 1918. That was a flu virus, and later many epidemic virus. Epidemic means they are spread to the limited area. So the later many epidemic viruses have come, which are like smallpox virus, measles virus. You might have heard about the smallpox virus and measles virus. And later then in 1960, first coronavirus was identified, and but its origin was not known. Later, say 10 or 12 species of coronavirus after 1960 has come or identified, you can say, and most uh, popular in sense, uh, popular in sense means we know about it regarding the spreading of the disease. And these viruses, coronavirus, are affecting the respiratory systems. So in 2002, the SARS-CoV virus had come, then MERS, Middle East respiratory syndrome coronavirus had come in 2012, and now we are having novel SARS-CoV-2, right? That is originated from China in 2019, at last of the 2019, that is in the December. So if you see the coronaviruses, different species of coronaviruses, the first that SARS-CoV in 2002, it was originated from the southern China in 2002, and 30 countries at that time, 30 countries were affected. Means it was spread in 30 countries, and 8,439 people were affected, and it has taken 813 lives. But later, again, this virus is not no longer existing. Now, next in 2012, a new virus, coronavirus, have come, that is or identified, that is a MERS-CoV virus. MERS means Middle East Respiratory Syndrome coronavirus. It was originated from the Saudi Arabia in 2012, and 27 countries were affected. And 2,494 people were affected, and it has taken 858 lives. Now, next virus, that is recently we are all facing the problem with this virus, novel SARS-CoV-2 virus, that is severe acute respiratory syndrome coronavirus. It was originated in a lab situated in Wuhan, China in December 2019, and is spread so fastly, and spread over the 216 countries, and 52 lakhs people of the world affected with this virus, and it has so far it has taken 3 lakhs 34,878 deaths. Can you imagine how is dangerous is this virus in India? If you see the figure of India, of the people's Indian peoples affected with this novel SARS-CoV-2 virus, that is so far just recently received data from the website that 1,19,419 Indian peoples are affected with this SARS-CoV virus, and 3,599 people died due to this COVID-19. The disease caused by this SARS-CoV is called COVID-19. So you can see how is uh, dangerous this virus. Say, if you see the emergence of the coronavirus, as I told you, this SARS-CoV virus, this is SARS-CoV virus, and this is the MERS-CoV virus. And as I told, it is originated from the southern China in 2002. And any virus, any coronavirus, zoonotic virus. Zoonotic. Why these viruses are called zoonotic virus? Because they originated from the animals and spread into the human beings. That is why it is called zoonotic virus. And the SARS-CoV virus. Uh, Coronavirus having large family of the virus that are known to cause illness ranging from common cold to severe diseases such as Middle East respiratory syndrome or severe acute respiratory syndrome. So coronavirus, what we gather information, the coronavirus are affecting the respiratory, especially the respiratory system of the human being. And this novel coronavirus, which causes coronavirus 2 causes COVID-19 disease, which is also a respiratory disease. The disease start from common cold and dry cough and fever, and in severe cases, it affects the respiratory system and collapse the people. Say the severe acute respiratory syndrome SARS. This is caused by coronavirus known as SARS-CoV virus, and as I told you, it is originated from the southern China in 2002 and spread over the 26 countries. And it has taken over 8,000. It has affected over 8,000 people, and in this case, the fertility rate was 9.6%. And in these infections, the approximately 21% health workers were affected, and it has taken over 774 deaths. Now, another symptoms, that is Middle East respiratory syndrome. It is caused by the MERS-CoV virus, coronavirus, and it was identified, as I told you, it was identified in 2012, and it spreads over 27 countries, and so many people were affected. Globally, 2,490 people were affected, and it has taken 858 deaths. And fatality rate was 34.4%, and it has affected approximately 19% health workers. Now, next virus that is very recently we are facing the problem, that is of novel coronavirus, originated from the lab situated in Wuhan city in China in December 2019, and at that time, 4 cases of pneumonia of unknown etiology reported. WHO in 2019 called this virus as novel coronavirus on January 7, 2020, and renamed after genomic sequencing. After knowing its genomic sequencing, the WHO renamed it as severe acute respiratory, call it SARS-CoV-2. And disease caused by this SARS-CoV-2 is known as COVID-19, coronavirus disease 2019, that is COVID-19. Sorry. If you see this structure of coronavirus, it is called coronavirus. And the a peculiar feature you will find in this virus, that is the spike proteins, right? And these proteins, spike proteins, are responsible for entering to the host cell, right, or human being cells, right? And it is having the amyloid protein E, and membrane protein, and altogether amyloprotein and mannan together form an envelope over this corona vesicles. Okay, so this spike protein that is very important. I would like to show you that how this spike protein will bind with the host cell for entering into the cell of the host. Say, if you compare the some statistics of the SARS virus with the MERS virus with the SARS-CoV recently SARS-CoV-2 virus, then and compare the fertility rate and RO rate value of the commonly known virus infection, then you will find that the RO is the one person affecting how many uh, persons, right? Or one contagious person, this how many people will catch the disease from the one contagious person, that is the RO value. So in case of the coronavirus, the case fatality rate 3 to 5%, and RO value is 1.4 to 5.5. The SARS-CoV virus, that is it was identified in 2002. It is having fatality 10 and RO rate 2 to 5%, while MERS-CoV virus having fertility rate 40% and less than 1 is RO rate. The H1N1 2009, that is swine flu, it is having fertility rate 0.03% and RO value 1.2 to 1.6%. And highest fertility rate we observe with this HIV virus, that is 80%, and RO value is 2 to 4. And smallpox virus have showing the fertility 17% and R value 5 to 7%. If you see the global scenario of various virus, the how many people are infected, what is the mortality rate, and how many countries were involved in spreading this virus. The SARS-CoV virus 2003 or 2002 to 2003, 8,098 people were affected, and that has taken 774 deaths. Approximately fertility mortality rate is 10%, and 32 countries were infected. And in case of the swine flu H1N1 virus, approximately 1,000 million people were affected, and death 0.4 million deaths were approximately observed, and mortality rate is approximately 0.05%, and 214 countries were involved. In case of the coronavirus, this is the recent one, Corona 2020 virus. The burden now it is increased from, these are old figure, now it is increased to 93,000 to 52 lakhs. The 52 lakhs people are affected, and it has taken over 3 lakhs deaths, right? 3 lakhs lives. It is having mortality approximately, these are the old figure, it is now more than this 3.4%, and countries involved, 216 countries involved in this coronavirus or COVID-19. So this epidemic started from the local. Generally, if you see these viruses, most of the viruses, I told you these are the zoonotic virus. They are originated from the animal and infect the human beings, right? So they started from these virus started from the local seafood market, right, where the animals are sold, or live animals or slaughter animals are sold, like bat or snakes or pangolin, right? So some.
Sir, your voice is not coming.
Pardon?
Yeah, now it's
Hello.
clear. Voice was not coming, sir.
Okay, I'm taking this.
Please.
Title. Just a minute. Just a minute. Is it okay now? Is it okay now? Hello.
Yes, sir.
Hello.
Coming. Voice is coming.
Is it okay now?
Yes, sir.
Right. So these viruses are spreaded as from the animals to the human beings. Most of the will find in case of the SARS virus, they transmitted from horseshoe vet to the human being through the civet cat. Say now come to this very recent coronavirus, that is the SARS-CoV virus. Novel SARS-CoV virus, as I told you, originated from the bat in the lab based in Wuhan, China, discovered by Chinese scientist Dr. Li Wenglin, right? And later on, this scientist is also infected with this coronavirus and died due to the COVID-19. Novel SARS-CoV is more dangerous than the previous one, as like other it is. It also affects the various human respiratory system, causing cough, cold, fever in initial stage, but in later stage it infects whole respiratory system, which causes death to the infected person. So I call it is a very dangerous virus as compared to the other previous coronavirus. The World Health Organization originally named this illness novel corona infected pneumonia (NCIP), but on 11th February 2020, the WHO officially renamed this clinical condition of this virus as COVID-19. The RO of SARS-CoV virus has been estimated between 2.2 to 3.28. That is, each infected individual on average causes 2 to 3 new infections. The incubation rate, if you see that, that is estimated to 14 to 25 days in adults, but in pediatric population, it is shorter. Now, why I call this novel SARS-CoV-2 virus a notorious virus because of fast mutation. It is a very smart virus. When it infects the any human cells, it mutates so fastly, so it is very difficult to control its consequences. Some mutations enable the virus to transmit more efficiently and infect more persons. Such mutant virus increase the frequency of transmission and sometimes completely replace the original type of the virus. That is the that is we are seeing in the SARS-CoV-2 virus. And coronavirus infection or COVID-19 begins in the patient through the throat, then enters his lungs and multiplies, mutated, and causing breath difficulties. Scientists said that A2A mutation of this coronavirus alter a component of its spike protein. As I told you, on the surface of the coronavirus, it is having the spike protein. So it altered the components of the spike protein, which is responsible for binding with the host ACE2 receptor, angiotensin converting enzyme receptors. So it will bind with the AC2 receptors because of altering the component of the spike protein. It's a very smart virus. COVID-19 has emerged as a pandemic because of the A2A type ability of the transmit easily. Because of this, it transmit very easily. Because of A2A types, it binds easily with the AC2 receptor of the host cell. Recently, it is reported that there are two coronavirus strains are in the population or spread in India, that is S and L type, and it is said L that L is more dangerous than S type coronavirus. The patient infected with the uh, L type of coronavirus are taking more time to recover than the patient infected with the S type of coronavirus. If you see the infections distribution of the COVID-19 worldwide, then as I told you, 216 countries are infected by this novel corona viruses too. So that most developed countries, the United States of America, 32.22% peoples are affected by this coronavirus, right? So you can imagine that yeah, in the United States, even in developed countries are not uh, could not escape with this spreading of this COVID-19, right? And India is having only 1.81% spreading rate. If you see the spectrum of diseases severity in case of the COVID-19, the COVID-19, as I told you, it was first reported in Wuhan, China, on 31st December 2019. Mild illness was reported in 81 cases. Severe illness, that is hypoxemia, reported more than 50%. And 14% pneumonia cases were reported. Critical diseases, respiratory failure, shock, multi-organ dysfunction was reported in 5%. And 4% acute respiratory disease syndrome was observed, sepsis, septic shock, myocardial infarction, and over fertility rate was between 2.3 to 5%. These are more serious in case of uh, comorbidities or weakened immunes. Comorbidities are means those people are having the disease like diabetes or having heart disease, cancer, pneumonia, or say asthma. In that cases, the this COVID-19 is more serious. This is how the infection is enter into the human beings from the animal, the bat. The coronavirus, as I told you, it is a zoonotic virus. It enters from the bat of this into the host human being, right? And through this S protein, this is pinky one, is through this S protein, which is attached over the surface of the this virus, right? It will bind with the ACE2 receptor of the host, a human host, including two subunit S1 and S2, right? And through this SCE2 receptor, these SCE2 receptor are the landing platform for the this coronavirus. So this through this S protein of the coronavirus, it will bind with the ACE2 receptor and enter into the human cells. So this M protein, these are the M proteins responsible for the transmembrane transport of the nutrient and bud release and the formation of the envelope. So this M protein, these are peculiar proteins available on the coronavirus. They are responsible after the entering into the cell. They are responsible for making the envelopes, but after the budding, and they responsible for making the envelope. N and E protein, this N and E protein and several accessories protein interfere with the host immune system or unknown functions. So that these protein, N or E protein, are interfering with the host immune system, right? So this coronavirus bind with the, as I told you, with the human ACE2 receptor, and then enter into the human being cells, host cell, and it is causing the individual who are more susceptible to the disease,
like say elderly patient or people with underlying disease like heart disease or say diabetes. It is causing the underlying health condition that increase the susceptibility of this disease are hypertension, chronic obstructive pulmonary disease, diabetes, cardiovascular disease. In such cases, the susceptibility of this virus is more. And the complications, severe complications, which we'll get, that is the respiratory disease syndrome, septic shock, metabolic acidosis, uh, metabolic dysfunction, and multiple organ failure. So, if you see the life cycle of the SARS-CoV-2 in the host cell, when the host cell enter into the respiratory system of the coronavirus enter into the host cell through the respiratory tract, it will bind with the S protein of the virus will bind with the host cell receptor AC2, and then after receptor binding, the conformation changes in the S protein facilitate the viral envelope fusion with the cell membrane. It will fuse with the cell membrane and endocytosis, and virus will reach into the inside in the cytosol of the host cell. The Then it will release the genome RNA is translated into the viral replicate polyproteins, that is PP polyprotein 1A, polyprotein 1B, which are then cleaved into the small products by viral proteinase, right? And it will release the RNA's genome material into the, and this polymerase produces a series of subgenomic messenger RNA by discontinuous transcription and finally translated into the relevant viral protein. The viral protein The viral protein then assemble into the viron and then transported via vesicles and release out of the cell for the infection of the other host cell. This is the schematic presentation. This is a schematic presentation of how the virus enter into the cell. This is the host cell, how it will enter. The spike protein, this gray one, they will bind with the SAE2 receptor and it will fuse and it will endocytose into the cell cytosol, and this vesicle will then cleave and release the genomic RNA material. It will disturb, it will bind with the, then budding is taking place. This is the budding is taking place with the genetic material, and with the help of the Golgi, it will form small vesicles that are called virons, and then it will be exposed from the cell. If you see the pathogenic condition, pathogenesis of this COVID-19, then we'll find that if the person is infected with the COVID-19, then there is a decrease in the lymphocyte count and significant elevation of the neutrophil. Meanwhile, inflammatory markers were markedly elevated, including C-reactive protein, ferritin, interleukin 6, and there are so many proteins, then inflammatory proteins, the level of that is increased and increase the mortality of COVID-19, which are associated with the increased mortality of COVID-19. Subset analysis show a general decrease in B cell and T cell and NK cells, which was more prominent in severe cases. So if you see this structure where we have tried to show you the pathogenesis of coronavirus, say in this case, at the bottom, you will find that at what level, which drug or which molecule will be affecting. This is the cycle of the coronavirus, 0 to 14 days. And at the entry means at it entry point, the spike protein will bind with the SU2 receptor if is there any molecule? If we invent any molecule which will prevent this binding, then we can save our patient, or we can save the pupils by spreading this infection of this virus, right? Then on what happened in case of the virus replication in the airways means, if the in the cells of this, if it is bind and enter into the cell cytosol, then this antiviral disease will be acting. They will be helpful for preventing its replications into the viron, right? And then activation is, say if the virons are coming out for new infections, then these three pathway, lectin pathway, and some antibodies pathway, or toll receptor pathway, these three pathway, through three pathway, if you are able to prevent these three pathway, then we can spread infection in the host cell, further infection in the host cell. Like we can have specific inhibitors. If we have pathway inhibitors, lectin pathway inhibitor, or antibodies pathway inhibitor, or toll-like inhibitor, then this will be more successful therapy, that will be complement activations, complement proteins activations. Or we can have anti-C3, anti-C5, or anti-leucon 6 1, or INF, anti-INF. They will be also activate the innate immunity system in the lung, and so that is more maybe effective in reducing the acute respiratory disease syndrome. So there are different drugs acting at different stages of the distinct pathway of the uh, coronavirus. Say, if you see this uh, chemostat mesylate, it inhibit this protein, and that is the TMPRSS2, and it will prevent viral entry into the cell. And there is one more drug, Arbidol. Arbidol targets S protein. It targets S protein or SEE2 receptor interaction. So this Arbidol prevent the interaction of S protein with the SE2 receptor and inhibit membrane fusion of the viral envelope, right? So if it is inhibited, then this viral envelope will not be fused with the membrane of the whole cell. Then hydroxyquinoline or chloroquine, their membrane fusion and endocytosis, they inhibit the viral entry and endocytosis by multiple mechanisms, as well as host immunomodulatory effect. Then these say if these drugs are not acting and virus enter into the cell, then in between, when when the virus is in the process of transmitting its genomic material and forming the new viron, then in between pathway we can give some antiviral drug, say lopinavir or darunavir, that inhibit three chymotrypsin-like proteinase, or ribavirin, or remdesivir. These drugs inhibit this protein, viral protein. So this pathway will be inhibited. So there will be no further, there will not be further multiplication of the virus into viron, right? And no budding will be taking place, no assembly will be taking place, and one more drug, that tocilizumab or serilumab, it bind with the interleukin 6 receptor, prevent interleukin 6 receptor activation, inhibit interleukin 6 signaling, and we can uh, uh, get relief of this infection, COVID-19 infections. So, what will be the what is the verdict of WHO, World Health Organization, on the novel coronavirus 2? The WHO Director General Dr. Tedros Adhanom said, the ultimate measure of success will not be how fast we can develop tools, it will be how equally we can distribute them. So, none of us can accept a world in which some people are protected while others remain exposed. We have to take care of all the peoples of the world. Right? This is an opportunity not only to defeat a common enemy, but to forge a common future, a future in which all people enjoy the right to the highest attainable standard of health and the products that deliver that right health for all. So we have to think about the health of all, not for some limited population. We have to think for all the citizens of the countries. So it is said then when we keep our hands clean, we can ourselves safe and we keep others also safe. So this is especially in case of coronavirus. We have to clean ourselves all the time. We have to keep our hand clean and keep ourselves safe and keep others also safe. Now, the WHO response on this SARS-CoV-2 virus. WHO declares global emergency because you can imagine that till now 32 lakhs people of globally infected, and it is also said by WHO that novel SARS-CoV-2 will last a longer way. People have to live with this virus, right? Like other virus, they have to live with this virus. All over the world, the COVID-19 pandemic is causing significant loss of life, disrupting livelihood, and threatening the recent advances in health and progress towards global development goals, highlighting in the 2020. Dr. Tedros said, the good news is that people around the world are living longer and healthier lives. The bad news is the rate of progress is too slow to meet the sustainable development goals and will be further thrown off track by COVID 19. So this is really very alarming situation. But in case of the India, India is relatively spared in with this SARS-CoV-2 virus. Why? Because we have limited number of travelers. The India and China habitat for 37% of global population. And more importantly, we have predominant population vegetarian, right? And we have very limited population, non-vegetarian population. Limited consumption of deeply fried and roasted non-vegetarian food, and predominant use of fish and chicken, these are the carriers of the virus. Improved weather condition, we have weather relatively improved weather condition and excellent government response. This is because of that excellent government response, we can limit the spreading of this COVID-19 virus. Otherwise, in India, the situation could be very worst. The transmission of SARS-CoV-2 virus is taking from human to human transmission through the respiratory droplets, sneezing or coughing. Virus is also detected in urine or saliva. It is also detected in fecal sample and anal swabs, also through the contact and fomites, non-living organisms, which are infected one. Say these are the mode of transmission of the COVID virus. Say if an infected person sneeze or cough, then virus will be come with the droplets of the on the droplets of the cough, then it will infected, these infected droplets come over the infected or go over the hand, and when we shake this hand, it will be transferred to the other person. Similarly, if we sneeze, if sneezing is taking place by infected person, the infected droplets come over the chair or table or some surfaces, right, on the L drop, right? Then we touch that surface, it will come on our hand, and if we touch our nose or mouth, then our human being will be infected. Then we will be infected. These are the symptoms you will find if the person is infected with the COVID-19. Say respiratory system will be affected. First of all, the respiratory, as soon as the virus is enter into the human being cells, it will affect the respiratory system. Sneezing, you will have frequent sneezing, running nose, sore throat, dry cough, shortness of breath, right? And after that, we'll have the fever, fatigue. Then our kidney will be kidney function will be decreased, and we'll have diarrhea. In some of the cases, diarrhea is also observed, and in the circulatory system, the white cells, white blood cells, WBC, decrease. So the in the COVID-19 disease, severe acute respiratory illnesses occur. A patient, how this illnesses will occur? A patient with acute respiratory illness, regardless of its severity, who had exposure to any one of the following in last 14 days, due to close physical contact with the confirmed symptomatic cases. If you have close contact with any confirmed symptomatic cases, then it will infect the person. Then if we come in contact with the healthcare facility where hospital associated novel coronavirus infection have been reported, then healthcare associated exposure with the direct patient care, working with healthcare workers infected with coronavirus, visiting patients, staying in the same close environment of a novel coronavirus patient, and some cases working together in close proximity or share the same classroom environment with a novel corona patient, or if we are traveling with the novel corona patient, then we will be infected. Living in the same household as a novel corona patient, then we will certainly infect our uh, close persons who are living in the same house. And in this case, a person having the severe acute respiratory illness, if we come contact with this, then it will be person will be infected, or person having fever measure over 38 degrees centigrade or 100 degree Fahrenheit, then there are chances of COVID-19. And a person having cough that is lasting over 10 days, then which require hospitalization, maybe in case of the COVID-19. So we have to distance with social distance with all these people if you want to keep ourselves away from this COVID-19 or coronavirus to. So this is, if you see this, how you have to keep yourself safe. We have to keep social distancing. We have to, social distance doesn't mean that you will not talk to the COVID-19 infected people, suffered people. But you have to take all the precautions to keep away from these infections, like social distance. Because if a person is infected, if he is sneezing, right? The droplets comes, and droplets may have the virons, right? And if we are having the distance less than 1 meter, because it travels, the sneezing droplets travels only up to what we say 1 meter, right? So if we are lesser, we are in contact, we are not maintaining the distance of one more than 1 meter, then we may infect with this SARS-CoV virus. So, how to prevent from this virus? So, it is said the prevention is better than cure. कि अपन को वायरस होना ना दें. So we have to wash our hands frequently with soap and water and alcohol-based hand rub. We have to cover our nose and mouth with coughing and sneezing pupils with during the coughing and sneezing with tissue or flex elbow. Right. This is the flex elbow. Avoid close contact with anyone with cold or flu-like symptoms. So uh, we have to keep distance with these peoples, and avoid close contact with those who show sign of flu. We should again have social distance with the person who are having the flu. Avoid unprotected contact with the live wild or farm animals, because these animals may be they are the carriers of the most of the virus. So we have to keep away from these animals. Thorough cooking meat and eggs. So now whatever if we are non-vegetarian, in that case we have to cook it properly. And most easy way to keep away ourselves from this corona virus 2, that is by hand hygienes, right? WHO has given a guideline on hand hygiene, that is it is said that following contact with the patient and or contaminated environment, microorganisms can survive on hands for 2 to 60 minutes, right? In during this time, if we if our hands are infected and we touch our mouth or nose, then it may affect the person, right? So, what were the indications for use of for hand hygiene? Say, if you use alcohol-based hand wash, we have to wash it before and after any direct patient contact. In between the patient, whether or not gloves are worn, immediately after gloves are removed, we have to wash our hand. We have to wash our hand before handling an invasive device. We have to wash our hand after touching blood fluid, body fluids, secretion, excretion, non-intake skin, and contaminated items. Even if gloves are worn, we have to wash our hand. During patient care, we have to wash our hand when removing from a contaminated to a clean body site of the patient. We have to wash our hand after contact with inanimate object in the immediate vicinity of the patient. We have to wash our hand. So the major step is we have to wash our hand. We have to keep this practice in our life. So we have to frequently wash our hand and avoid spreading of the infections. There are different type of the hand sanitizer. We can use alcohol based hand rub sanitizer is the best one, and antimicrobial soap can also be used, and plain soap, that is also good for cleaning our hands. Say which part of the, if we normally clean our hands with water, some of the places of our hand are area of the hand are missed during the hand wash. what are these? Are red one area are missed uh, during the hand wash. They are infected one, right? So after the washing, even these places are not cleaned properly. So we have to, and this blue one is the less frequently missed after the cleaning. So we have to clean our hands properly. There is a procedure by which we have to clean our hand properly so that nothing can left on the our hands. It will be free from the microorganisms. Like, so first of all, how to clean our hands? First of all, we have to rinse our hand below the this tap, right, with the water. Then use soap and rub the soap and spread on the palm, then on the back side of the palm, uh, and then toss the this thumb, both thumbs to be boss and clean. Then finger interlocking clean. So in between the fingers we have to clean it by finger interlocking. Then wrist, we have to rub the wrist also with the another hand, right? And nails may sometimes is more is the primary site for the viruses. So we have to clean nails also by rubbing nails, by interlocking the nails with the another hand nails, right, and rub it frequently. So these steps, if we follow, then we will be free from the virus. WHO has given the 15th May, they celebrate 15th May as a hygiene day. And October 15, they celebrate as hand washing day. So on these days, they demonstrate how to keep hygiene and how to wash our hands. Now, next step, after washing the hand, it is said that you have to wear a mask, right? Now, question is how to wear the mask and where to wear mask. Which mask will protect against the new coronavirus? If we use simple medical mask, surgical mask, then will it protect against the new coronavirus? Answer is no, it will not protect, but it will block the liquid droplets. If someone is sneezing, so it will block the droplets. So direct droplets will not go your nose. Don't fall, do not fall full protection against the airborne viruses. And our bearer eyes means those who are wearing this surgical mask or medical mask, uh, his eyes remain exposed. Don't fully seal off nose and mouth, because so if it is not our nose and mouth is not fully sealed or properly sealed, then there are chances of spreading of the virus, or we may bearer may infect it if he wears this medical face mask. So N95 or N99 mask, N95 or N99 mask means 95% or 99% particles will retain. These, if you wear this this mask N95 or N90 mask, it will protect 90% or 99% particles. It will not allow you to infect your nose or mouth. This is 95 mask. It is having it is more efficient, having ability to filter out oil-based pollutants, and but it is no doubt it is more expensive. So you are required to replace this mask after 40 hours of uses. Now, next step, that is the treatment of the this. If one is infected with this COVID-19 or coronavirus 2 virus, then what will be the treatment? So far, there is no treatment. Only we treat the symptoms. So symptomatic treatment is available. No specific antiviral therapy is reported so far. Although they are using number of antiviral drugs, and in some cases it is effective, in some cases it is not effective. And therapy and vaccine still in embryonic stage, and hopefully within 2 or 3 months we'll get the vaccine. If we get the vaccine, that will be uh, uh, our scientists will be relatively relaxed. So that there are 4 treatment approaches, either by inhibiting the SARS-CoV-2 virus infusion entry, or the entry point is we inhibit the infusion entry, or disrupt the SARS-CoV replication if we inhibit or disrupt the pathway of the replication after the entry. Then suppression of excessive inflammatory responses, that is outside the, if the virus come outside the cells, then our protective immune system will be affecting, and cytokines release. Also, we can, if we suppress the excessive inflammatory response, then we can get relief with this COVID-19 or coalescence plasma therapies. Means if we inject the antibodies of the infected person, or the person who is cured by this after this COVID-19, then we can use this plasma therapy. If you use that plasma, then it may, antibodies of that person may help in fighting the antigens of this coronavirus. These are the different drugs, and these are the different targets where it is acting, and this is the mode of action. So number of antiviral drugs are used for, or we can say rather, try to get relief with this COVID-19 infection. The chloroquine, hydroxychloroquine, that is also used for getting relief with this COVID-19. Then erythromycin, right? Recently, recently, 3-4 drugs are very popular for the treatment of this COVID-19, or for getting the patient relief with this COVID-19 if he is infected. That is getting rebooting. Say erythromycin, in most of the cases, erythromycin is also acting because it decreases the expression of some metalloproteinases, diastome of the CD147, and induces antiviral responses, right? So these are the common drugs or therapy are generally nowadays using ropinavir or ritonavir, or combination of protinavir and ritonavir, and hydroxyquinoline, erythromycin, hydroxyquinoline along with the azithromycin, and plasma therapy. So these are the nowadays commonly used drugs or combination for the treatment of COVID-19. Now it comes to the role of the pharmacist. This is pharmacists play a very important role to overcome the spreading, or we can overcome this pandemic situation, because pharmacists are most essential healthcare provider, as you know. It is a first touch point of the patient. First, because if we see that if we have some health problem, first, instead of going to the physician or clinician, first we'll go to the medical shop and we'll ask, we are having these, say, cough and cold. Can you give me any medicine? Right? So it is the first touch point of the patient. And first-hand information provider in rural and underserved communities, right? Caretaker of medicine and vaccine. And he is the stockholder of desired medicine and vaccine. If there is no legal barriers, he may be trained for infectious disease. If government allows pharmacists to initiate antiviral therapies in coordination with the physicians. So in many ways, pharmacists can very important role to come up with this pandemic situation. The pharmacist can reduce the burden of patient on the hospital as well as on the clinician and physician. Community as well as the hospital pharmacist can contribute in many ways as they are first health provider to the society. Now, community pharmacies in which are in outbreak in affected or in unaffected areas. As I told you, it is the first point of contact with the health system and patient. It provides need-based information and reliable advice to the patient, and for achieving high-level immunization. This is very important. In our India, pharmacists are not being used for immunization purpose. If they are permitted, then they can help the government in a big way for immunization. Say if so far there is no vaccine for the COVID-19, but after when the vaccine will come out, right, for the use, then everyone has to be immunized. Every has to be vaccinated. Then pharmacists play very important if he is giving proper training and proper authority, then they can play very important role. If they are authorized for testing of other infectious disease with the similar symptoms that could be mistaken for COVID-19, such as influenza, they may be allowed to start. Say, sometimes what happens if we are having some infection and if we go for COVID-19 testing center, then it will be unnecessary loading to that center of the patient, because on a primary basis, if we able to test that okay, this person is having the simple flu or influenza or some other infection other than COVID infections, then we can reduce the load on the this COVID-19 testing labs, right? So if the pharmacists are allowed to start a point of care testing center, POTC, for testing infectious disease, which will reduce the unnecessary burden on clinician and physician, right? So POTC will reduce the unnecessary burden on clinician and physician. Only those patients who are needing high level of care will be referred to their physician and or hospital for treatment. So there a screening will be, a preliminary screening will be taking place of the patient before reaching to the hospital or physician by the pharmacist. The community pharmacist can share responsibility of ensuring adequate storage and supply of appropriate stock of pharmaceutical product and devices in such a pandemic situation, such as medicine, mask, PPE kits, especially in such pandemic situation. Informing and educating the public, this pharmacist, community pharmacist can play a very important role, because he knows, he is aware about these viruses, so he can, and effect of these viruses, so he can easily, and they are first point of contact with the patient, so they can easily inform and educate the public, counseling the public and patient, because they are first point of contact, referring the patient for a specialized persons, because the patient first go to the pharmacist. So, and if the pharmacist interact with the patient and understanding about the disease, then they can refer that patient to the specialized physician, promote disease prevention, promote infection control, right? So in addition to COVID-19 related roles, pharmacies provides an essential public services to the whole population through the supply of medicine and pharmaceutical care. In the hospital, pharmacist can also play a very important role as a hospital pharmacist in outbreak affected and unaffected areas, such as, no doubt, ensure adequate storage and supply of appropriate stock of medicines and other medical products and devices in this pandemic situation. Collaborating with the health professional in providing patient care and supply, promoting hospital for prevention and control of infections, informing and counseling of the patient, ensuring the responsible use of the pharmaceutical product supply. They can educate the physician as well as the patient how to use their pharmaceutical products. For example, they can ensure the healthcare professional how to wear their mask and how to take them off correctly to avoid contamination. They can educate them pharmacovigilance and monitoring treatment outcomes. So, right, they can have vigilance on the disease and its treatment. So there will be the very important person as far as this pandemic situation is concerned. The overall role of pharmacists, our entire pharmacy, or you can say entire pharmacy team should be trained for technical and scientific information on COVID-19, in particular on the symptoms, incubation period, modes of transmission of virus. So if they are properly trained, then they will be an asset for loading the burden on the physician and hospitals. Epidemiological information on affected area, if they are trained with this, then they are required to be updated with the figures of the number of confirmed cases per country. They should also visit the relevant authentic web pages for information collection, information on prevention and measures, including information on disinfectant and proper hand sanitization if necessary, face hygiene, information on how to proceed in a suspected case, including strategies that every pharmacy should implement, and material available to support the intervention, that is information process, intervention flow chart, and acute information website. So this is very important. If the pharmacists are trained for these especially technical and scientific information of COVID-19, then they will be very helpful for minimizing the spreading of this coronavirus too. Obviously, but there are responsibility of exposure of frontline pharmacists to the COVID-19 exist. There are number of cases we observed during this COVID-19 and during this pandemic situation, because they are interacting with the patient who are possibly infected, right? Therefore, healthcare workers should workers should take measures to protect themselves as well, right? ऐसा कहते हैं ना कि दूसरों को बचाते बचाते अपने भी हाथ जल गए, तो बेटर है कि पहले अपने भी हाथ बचाना चाहिए. So post lockdown in prevailing COVID-19 situation, after the lockdown, we have to be more careful because we will not be knowing who is carrier of this coronavirus and may infect you. so that we must have to take all precaution which we were taking during the lockdown period. ऐसा नहीं होना चाहिए कि आफ्टर लॉकडाउन हम फ्री हो गए कि हम अब तो इन्फेक्टेड नहीं होंगे, लॉकडाउन खत्म हो गया, बट दिस इज नॉट ट्रू. After the lockdown, we have to follow all the precautions which we were taking during the lockdown. So people must have to understand their responsibility. They should be educated with the COVID-19 situation. Keep social distancing at every places. Regular sanitization. Everyone should wear face masks to prevent spreading of the virus through the cough and sneezing. Frequently disinfectant the working places. Frequently with sorry. Frequently, with a proper disinfectant like 1% sodium hypochlorite solution or any phenolic solution as given by WHO. All worker, employees, officer, student must be thermal screened before entering into the office or classroom. Keep records of every employees or students who are coming from the other infected place. Meeting may also be organized using video conferencing, mobile apps. Use virtual mode of teaching and learning, and all citizens should be asked to use Arogya Setu app as recommended by Government of India. We have to put the notice at the entrance of the pharmacy, right, for the customer, like the disinfectant your hand when you enter in the pharmacy. Everyone has to disinfect their hand when they enter into the pharmacy. They should make sure that they are keeping distance of 1 to 2 meters between them, and or any one of the pharmacy staff. So they should have proper social distancing when they go to the any pharmacy. Do not walk outside the floor marking. We have to put floor marking just in front of the pharmacy. So we should not walk outside the floor marking. If you sneeze or cough, cover your nose, mouth with a handkerchief. You should discard that handkerchief in a suitable container, and it should not be reused or with a flat elbow. We have to put our elbows on the nose during the sneezing or coughing. Avoid shaking hands, close contact while in the pharmacy. Prepare in advance the prescription you need to fill. That these information you have to put at the entrance of the pharmacy, so that will also educate the patient how to keep themselves safe from this coronavirus too. At the pharmacy counter, or you can say on the counter, whenever possible, allocate one employee per station or location at the counter and avoid swaps. All pharmacy staff at the counter are encouraged to wear a face mask for additional protection of both themselves and public. Keep at the counter only essential objectives. Wipe and disinfect the counter after each customer or patient. Have a alcohol-based solution at hands to disinfect hands after attending to each patient customer. Where possible, encourage patient to order their medicine through the pharmacy's website, depending on the jurisdictions, or through the phone or mobile, and deliver to their home or workplace. So if we do this way, then we can protect our population from, or protect our population from this COVID-19. So in this way, how to keep social distancing. Everybody nowadays, we are all well educated with this social distancing. Since last 2 months, we are listening about the social distancing, and we are know the meaning of social distancing just by limit the number of patient customer entering the pharmacy at any one time. Establish a safe distance of at least 1 meter when attending to the patient. If necessary, a tray may be used to collect prescription, hand over medicines, hand over the medicine, and process the payment in order to overcome this distance. Advise patient to keep a safe distance of at least 1 meter between them while waiting, and use marking tape on the floor to indicate where they may stand. There are some advice to the patient and customer also. Avoid long stay in the pharmacy. We should not allow to stay much. We should not allow patient to stay much at the pharmacy. Avoid visiting the pharmacy if they are elderly or have comorbidities. We have to avoid, and whenever possible, such patient should ask a family member or friend or neighbor to go to the pharmacy instead of them, because they will be more vulnerable with this COVID-19. This is some picture how to wear mask. Right, there are, as I told you, there are two masks, face mask, last है. So this is how to wear and how to remove the mask. Before wearing the mask, you have to clean your hands, disinfect in your hands, then you wear the mask, and you have to, on the top of the mask, you will find it a hard tube. You have to press that so that it will close the space between the mask and the nose. So it will be tightly pack your mouth and nose. And after using it, you remove it from the this thread or elastic and throw it into the dustbin. And every time you have to, when you touch or when you put a mask or when you remove the mask, you have to wash your hand at least 20 seconds. There are different ways you can use. This is the correct ways of using the mask. That you have to press here at the nose. You have to press. There is a tube. You have to press it so that there should not be any space, right? And you have to use proper this string. You have to use properly. You have, right. So this is about the how to you have to use your mask, right? So this is all for how to keep yourself away from this COVID-19. WHO said, be supported, be careful, be alert, be kind, and be ready to fight COVID-19. Thank you very much.
Hello.
हाँ जी yes,
Yes, sir.
thank you very
Thanks
much.
for your wonderful session. I hope that all the viewers will be benefited with your overall talk. And have a nice day, sir. Thanks a lot.
Good afternoon to all the audience. I, Saurabh Kose, coordinator of 2 days virtual international conference on COVID, welcome you all back. I have immense pleasure to welcome our next speaker of the technical session, Professor Dr. N. Ganesh. Dr. N. Ganesh is currently serving as head and senior scientist, Department of Research, Jawaharlal Nehru Cancer Hospital and Research Center, Bhopal, Madhya Pradesh. Sir is a very eminent scientist, particularly in field of oncology and cancer research. He got 2 patents to his credit. He discovered active constituents against skin melanoma from Jalkumbi. He is having a total impact factor of 134.4 add with 71 research papers. He has presented more than 108 scientific papers and 39 posters at various global and national platforms. Sir has guided 11 PhD scholars and around 189 postgraduate theses and a registered PhD guide in genetics, biotechnology, zoology, life sciences, pharmacology, as well as medicinal chemistry. He is life member of various national and international bodies, various public and private funding agencies. He got State Best Scientist Award in particular area of cancer research, as well as he has got 22 Best Scientific Poster and Paper Awards. He has authored various national and global books, and particularly he has designed 27 animal houses, 7 biotechnology labs. So in a short, if I tell, sir is a very renowned academician, very disciplined profile in terms of oncology cancer. So without taking much time now, I would like to request our speaker of the day for the session, Professor N. Ganesh sir, to come with his presentation and particularly enlighten our audience. Yes, sir, you can start the presentation. Yes, sir, you can start the presentation. Sir, you can start the presentation. Sir, you can start the presentation. Screen there.
but still I have some problem. Like people talk about the symptoms, but few of my doctor colleagues they are positive, they are under treatment, some are under quarantine, but they're asymptomatic. Now, question comes like whether these symptoms, which is being defined and governed by WHO, is really valid for a new course coming up, or we have to wait for the infection when we're traveling. My dear friends, before causing an infection, this forum given a chance me to speak about the dietary management for this, how we can safeguard, whether we are health practitioner, whether we are policeman family, whether we are Nagar staff, whether we are layman. Like we have to do, otherwise this lockdown may over by 30th of this May. And what will be done? After 2 months, the increased rise rate of the infection will be so long. I'm not going to talk about this infection because personally I feel like asymptomatic is much more worrisome problem. And WHO had put on so many concepts for dietary management. But here, being a cancer specialist, I'm working for a cancer patient. The vulnerable populations are cancer patients. They put on first in rank cardiopathy, the cardiac diseases, diabetic, tuberculosis, influenza, other infections, and geriatrics. Worrisome age is plus 60 age and the childhood, infant age. But how we can safeguard ourselves? The medicine is still in. I have to come. The regulator has to decide. ISMA of Indian guidelines has to decide whether this medication to be given or not. The prophylactic dose has been given. Combination has been given. Somewhere the antimalarial drug was working. Somewhere tuberculosis drug is working. Somewhere they're giving crocin only. They're saying right now, this morning, I got information from Tata Memorial. One of the doctors says that one of my sister being a ICU staff, consultant, she came back from there and she told only we had given vitamin C and crocin. Paracetamol. The question mark is the world is struggling to define and design the antibiotic dose. Still, it is not available. I'm again thankful to the team of IFS for making me to share this personally experience with the patient. We have a patient with high grade fever, we have a patient with infection, lung metastasis. We are worried whether they are positive or not. But what I feel like, hello, and can you hear me, sir? Hello, 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 can you hear? Amit ji, Amit ji, can you hear me?
Hello.
Hello. So these guys are like, hello, can you hear me, sir?
You left
It is
the
audible?
meeting laptop, sir.
It is audible, sir.
From the laptop you left the meeting, sir. Please join.
Hello. for entire area. But what to do in these cases? We can't avoid treating cancer patients. We have to welcome them. So we designed some wonderful diet, and these are the diet they had already. WHO had given a guidelines. You have to take this. And this morning, the Government of India, Department of Health and Family Welfare, examining body for paramedics training of the Government of India, and they had given what are the steps here. They said what they have to take in so much of spicy food
Not working.
and have to take nutrition balanced diet, vitamin C, social distancing, mask has to wear, and सर ये तो चालू है सर
But this is not
हेलो
working. Again, the
यहाँ
presentation.
से शेयरिंग शो कर रहा है सर तो यहाँ तो शो कर रहा है ये
Just in a moment, I will give the signal.
Okay, sir. Okay. Okay. फोन देखते रहना तुम लोग।
Just in a moment, sir. We will be live. Okay, sir. You can start.
चालू
Yes.
करूँ?
Yes, you can start.
Yeah, sorry, dear friends. Like, because the technical issues, coverage, and could not speak much. People are knowing about in the world like what are the signs symptoms of COVID-19 infection. Coronavirus is deadly, and in Bhopal, when I talk about my place, it is increasing every day. 40 to 50 patient new cases every day it is reporting morning to evening. But being a medical fraternity, my cancer doctors, many doctors, they reported that we are asymptomatic. One day we find we thought lethargic little bit, and we thought to have a screening because daily they are looking after these cases, and it became positive. And finally, this is asymptomatic. Like there is no fever, there is no cough, there is no headache, there is no difficulty in breathing, there is no sweat, there is no tiredness much. But still they are positive. So my worry is about there are vaccines going to be, there are pharmaceutical companies there in the under the trial the drugs. Fermentation combinations are being given, antimaria somewhere in dolo 650, antipyretic somewhere anti-tuberculosis. People are giving much, and homeopathic medicine, Ayurvedic medicine is also in this history. ICMR WHO has given signals to some homeopathic medicines, and they are giving fermentation combination. And still, we are in tough times. Whether really we need something to alarm or not. This is the right time, sir. I'm thankful to Moga ISF, the group, who invited me for this issue, and I'm going to share two of my experiments which we recently performed 1.5 months. My CEO, Srimati Divya Parashar, had initiated this. Dr. Sajia, Dr. Aliba Rawat, and Samin Akhtar was my co-worker for this project. Make it next. Make it next. Yeah, and to the previous one, sir. Yeah. These WHO guidelines were reported that they have given immunotherapy, dietary management, but I'm worried about cancer patients because being in cancer centers, it's more vulnerable, this kind of patients, because cardiac pulmonary metastasis is very common in cancer patients. Cardiopathy, again, there are connectivity, diabetic, tuberculosis, influenza, and other chronic infectious diseases. And secondly, the last worrisome is geriatric age group, above 70 age group is really worrisome. What to do, what not to do. Till we wait, do we have to wait for the infection to come and knock the door, or we have to take a precaution? WHO has asked us to do prophylactic activity, and we are going to present that. Next slide. Next slide, please. Yeah, these are the boosting previous. Yeah, WHO recently this make it previous, sir. Previous. Go back. Make the previous slide. Make it previous, sir. Yeah. Hold on. Hold on. Hold on. Yeah. Hold on. These are the immune boosting diets, and people knowing about you also. Your grandmother knows these recipes, and what we did different among this, we did some different recipes to enhance the boosting of immunity of our system. Make it next. Make it next. Amit ji, make it next. Yeah, this morning, this is from Government of India. The Health Department had released this. What general care we have to do? They told you from what I have to taken. You have to do distancing. You have to take masks. You have to do sanitizing. You have to do or herbal medicine, what the haldi and other things. Ayurveda medicines also had implemented, and Urani same time the homeopathic medicine, where they are reportedly saying that the Camphora 1M is going to be a boon to recover this disease from this disease. The Maharashtra police already providing Camphora 1M to everyone. What is the fact behind? I'm going to show that. Make it next. Make it next. Lockdown has been started on 23rd night, midnight, on March 23rd. But I'm sorry, like Government of Kerala initiated, the health ministry is very strong. On 4th of January, they initiated door-to-door survey. They force everyone to have a very good cautions over there. I would like to tell you, sir, since ages, the Kerala government, the Kerala people, Tamil Nadu, the border of Kerala, the Kanyakumari district, they are offering the kids and everyone the Jira waters, cumin water, and the soft water. Now, the Ayurveda says that they are going to help in anti-influenza dose. This is one of the remedy that they had initiated. Is Pankaja Kasturi. The ingredient is listed aside towards your left, right, and you can see that there are the main ingredients of this granules, a bit easy granules. We tested this granule to almost 1000 plus cases. Those who have cough and cold, they have chest pain, they have low immunity. 1 spoon a day, and they reported a very good immunity enhancement. So this is one of the best medicine what already marketing is doing. But I don't know how much the Central India people know about Pankaja Kasturi granules. But my dear friend, this is one of the best. On the basis of this, we had taken some ingredients and we had focused to the lung causing infection bacteria, mainly the Pseudomonas and Klebsiella. Make it next. Yeah, the first thing. This is Madan Mohan ki chai, rejuvenators, a place for rejuvenations, which is made by 4 different tastes. One is mesmerizing allspice tea. It's contain bay leaf, cinnamon, allspice, jaggery. Jaggery is not a sugar cane. It's not a good. It is a palm jaggery and cardamom, fresh cardamom. The second is hope of orange curcumin chai. There's sugar granules made by the palm jaggery. And third one is divine palm jaggery. It is a palm jaggery with salt, the dry ginger powder, and black pepper. The last is Jawad, the hope of chai, the Indian basil, cardamom, lal mirch. We tested 2, the mesmerized allspice chai and divine palm jaggery in patients. As per the patient is metastatic to lung carcinoma, lung metastasis, generally the breast cancer and other tumors. So we chosen those cases who underwent for radiotherapy. And 20 cases we had did 5 times follow. 1.5 months we had complete change of their immune capacity cells. Make it next. Make it next. This is the chart. This is the case study 1 to 20. Only previous one. Make it previous. Yeah. Make it previous. Bring it to the chart. Amit sir, make it previous. Yeah. You can see the red color is non-responding. Only larynx tumors metastasized to brain and bone and not responded to much responded to the change in WC count and platelet count. And you can see the other cases had maintained and increased the WBC count and their liver profile and kidney profile. Exponentially, they had maintained. It means that this precautions, this tea had really valued to to suffice the infection control on your upper respiratory tract itself. And we are giving this tea since almost one and a half months. And patient, what they're reporting, the insomnia is recovered, the irritation has been recovered, the उनका गुस्सा आना, उनका चिड़चिड़ाना, the appetizing behavior, the loss of appetite. Now because of this tea, they increase eating food also. What we added in this the diet. In addition to this, we asked them to take a lady finger, all the miscellaneous releasing diets like arbi, banana, this lady finger, the gilki, the thorai, green gods. This is immune enhancing diets. A part of this tea is being given 50 ml every day thrice prior to your food, and you can take in your food. These are the vegetables, the lady finger, the calicacia, that is arbi, and all the gods, bitter gods, water gods, the rich gods, ये सब लेने से इम्यूनिटी मेंटेन होता है, जो मेरे पेशेंट ने रिपोर्ट किया है. Same thing, we had given this remedy to some of the quarantine cases. They said that हमारा सर्दी जुकाम सर बहुत जल्दी से आराम मिल गया within a span of 5-10 days. Make it next. Make it next. Amit ji. Make it next. Amit ji. Hello. Yeah. You can see this prior to radiotherapy, oral cancer, and post radiotherapy, oral cancer. In post treatment, we had given 5 intervals of therapy of our tea, palm jaggery, and you can see both the pictures. On top, you can find the cases which is having micronucleus, the indirect evidence of DNA breaks, and low cellular morphology. Whereas the post radiotherapy, you can see the cell is devoid of micronucleus, means DNA is being repaired, and this is the beautification of this tea. It not only enhancing the immunity, but also protection your genomic structures. My dear friends, I'll repeat the tea recipe. Take a palm jaggery, take a water, take a dry ginger, cardamom, boil it and have it. This is going to safeguard your body system. And you can see the skin, oral mucosal lining also cleared. The fibrosis being repaired, the leukoplakia is being repaired, the ulcer is being repaired. In both the pictures, you can see exponentially increased upper and lower. You can see a wide range of difference of disease manifestation. And my radiotherapist says that patients saying that they are happy with this. Take caution. Make it next. Make it next. Yeah, another test we did, a flow cell microscopy. You can see a wide range of micronucleus are there. And when we had given a palm jaggery, you can see it minimized towards the left. You can see the minimized micronucleus, and towards the right there is macrophage cells, which is very inactive form. This is what the role of the herbal precaution. But mind it should not be a sugarcane jaggery. गन्ने के बना हुआ गुड़ नहीं होना चाहिए, ये ताड़ का गुड़ होना चाहिए. पाम जैगरी ताड़ का गुड़, ताड़ का गुड़ नहीं मिले तो आपको खजूर का गुड़ यूज करना चाहिए. मेरे पेशेंट ने क्वेरी किया कि सर कहां से लाएंगे, खजूर का गुड़ और पाम का गुड़ नहीं मिलता. आप पका हुआ खजूर को मैश करके उसको बॉईल करके उससे सिरप बना करके उसको गुड़ के रूप में यूज कर सकते हैं. लेकिन नेक्स्ट, लेकिन नेक्स्ट. Yeah, another test we did, a flow cell microscopy. You can see a wide range of micronucleus are there. And when we had given a palm jaggery, you can see it minimized towards the left. You can see the minimized micronucleus, and towards the right there is macrophage cells, which is very inactive form. This is what the role of the herbal precaution. But mind it should not be a sugarcane jaggery. गन्ने के बना हुआ गुड़ नहीं होना चाहिए. पाम जैगरी ताड़ का गुड़, ताड़ का गुड़ नहीं मिले तो आपको खजूर का गुड़ यूज करना चाहिए. मेरे पेशेंट ने क्वेरी किया कि सर कहां से लाएंगे, खजूर का गुड़ और पाम का गुड़ नहीं मिलता. आप पका हुआ खजूर को मैश करके उसको बॉईल करके उससे सिरप बना करके उसको गुड़ के रूप में यूज कर सकते हैं. लेकिन नेक्स्ट, Yeah, I request all the audience who is listening to me, please note down and take a screenshot of this recipe. I presented this particular atta in Punjab University recently in the month of February, but I'm sure that this is going to save your life. As I told, the vulnerable population is diabetic patient also. They are more vulnerable who are insulin dependent. I'll tell my father's example. My father suffered from diabetes since ages. 25 years he took insulin thrice, 15, 15, 20. Glycomate, metformin, 500, 500, 500. And one day in 2018 he collapsed. CBA reported 92% quantile damage, mid-brain damage. I was worried. The sugar was 700 count. And my father declared dead. After 3 hours of struggle, I put on a ventilator. I refused to take my father's body to my home. The director understood my feeling and he put on a ventilator and he revived. And after 3 days, he takes off ventilation. And after that, I took discharge, I took back to my father to my home. He was better, lying down. I asked only one question to my mom. मम्मी ये बताइए कि इतने साल से हमने इंसुलिन दिया, डाइट मेंटेन किया, नो राइस, बीइंग अ साउथ इंडियन, वी स्टॉप राइस. We strictly stop rice for my father. But why, mummy, this has happened? 700 count is not appreciable. I would appreciate when my insulin, but that day it was 700. So I told, जो हम देते थे उसको बंद कर दो, बाकी सब मैं ठीक कर दूं. Mama says we give only wheat to him. हम गेहूं के अलावा कुछ नहीं देते थे. मैं इस चैप्टर को कोरिलेट कर रहा हूं क्योंकि WHO says diabetic mellitus is vulnerable for COVID-19 infection. They say that those who are insulin dependent, they are much more vulnerable to your COVID-19 infection. My dear friends, my dear seniors, this is one of the best recipes for atta. I have taken 250 gram of rice. I have taken 2 kg of deshi chana. Hello.
Yes.
Can you see?
Yeah.
Hello.
Just yeah. Yes, sir.
Can I present?
I will take you live. Just wait. You are
Hello.
able to see presentation. Now check presentation is live or not.
Okay.
Sir, check the presentation. It's available.
The presentation नहीं आ रहा सर.
Sir, click on my name, second screen. Amit Sharma, second screen.
हाँ सर, आपकी स्क्रीन में देख रहा हूँ मैं।
सर मेरे नाम से 2 स्क्रीन बना होगा, एक अमित शर्मा में आपको मेरा पिक नजर आ रहा है, दूसरे में
ये
प्रेजेंट।
स्क्रीन में देख रहा हूँ।
आई हैव शेयर्ड फ्रॉम माय
केवल
साइड।
नाम आ रहा है सर, अमित शर्मा करके, स्क्रीन ब्लैंक है।
आ जाएगा सर, अभी देखिए।
हाँ
विजिबल?
नो सर, नहीं है।
देखिए सर,
हाँ
अभी
आ गया।
आ गया ना?
फुल
यस।
स्क्रीन कीजिए सर, फुल स्क्रीन कर दीजिए।
1 2 3 यस, यू कैन स्टार्ट।
हाँ फुल स्क्रीन कर दीजिए।
ओके, आई
फुल स्क्रीन कीजिए सर। यस।
यस सर।
My dear friend, I told about the atta, and please take that atta regularly. Lot of my patients are taking. They say that our lethargicness, cell toxicity, our chemo-induced toxicity, radiation-induced toxicity has been lost. What I said is that atta is very good. Stop eating wheat if you want to increase your immunity. And secondly, the stone food, whatever I mentioned, you must take it. You must take it regularly. It is going to help you. आप ऑरेंज के छिलका, लेमन का छिलके को चाय में डाल करके जरूर पीजिए, दाल में डाल तो जाते। लेकिन नेक्स्ट नेक्स्ट अमित सर, नेक्स्ट कीजिए, नेक्स्ट कीजिए।
दिस वन सर।
अमित सर नेक्स्ट कीजिए।
सर आई हैव ऑलरेडी डन।
हेलो, नेक्स्ट कीजिए।
सर आई हैव डन, इट्स नेक्स्ट स्लाइड ओनली।
नेक्स्ट कीजिए सर। स्वाइप पे नेक्स्ट कीजिए सर।
सर आई एम डूइंग इट। Which slide do you want? This one?
तो नेक्स्ट कीजिए स्लाइड। अमित सर,
Sir, I've changed the slides.
नेक्स्ट कीजिए।
Just doing it. Wait, sir, please.
जी
So this one?
सर, नेक्स्ट कीजिए। स्क्रीन हैंग सर, नेक्स्ट कीजिए।
Sir, you can continue.
हेलो अमित सर।
Sir, you can continue from this slide.
अमित सर नेक्स्ट कीजिए।
Sir, I did.
स्लाइड को आगे
Yes, Ganesh sir. Sir, there is a problem in the slide, I think.
क्या हो गया सर सर?
Sir, we are going to send this presentation to all the candidates. So please
करूँ
conclude
सर?
your.
चालू करूँ?
Yeah. Yes, sir. Please.
अपलोड नहीं हुआ अभी स्क्रीन में.
I think there is a problem in connection.
आपका वॉइस बहुत ब्रेक करके आ रहा है. या तो मेरा वॉइस केवल रख दीजिए, मैं प्रेजेंटेशन दे देता हूँ. दे दूं केवल?
Yeah, you're audible, sir. Please.
हमें सर डायरेक्ट वॉइस प्रेजेंटेशन दे दूं?
Sir, you can start from this slide. Is camphor edible?
ये इनका प्रॉब्लम है. हाँ. Can I speak? अमित जी,
Yes, sir. Did already did.
अमित जी बोलूं?
Yes, sir. Please.
Hello. The second experiment was like the homemade medicine people had talked about.
Ganesh sir, you're audible. Conclude your remarks. I will take you live for 5 minutes. Just without slide, you conclude your.
तो जहाँ अच्छा दिख रहा है वहां से डिस्कनेक्ट हो रहा है बार-बार. या आई कैन आई टेल. बोलना चालू करूं?
Yes.
सर बोलना चालू करूं?
Yes, sir. आप बोलना start कीजिए. You are live. No problem. I'm taking you live.
हेलो.
1, 2, 3.
कैन आई स्टार्ट?
Yes. Okay, sir.
Yeah. Nowadays you can find that the homeopathic medicine has been selling too much. They had told about Camphor 1M drug. The Malaysian police already into this. They are distributing Camphora 1M dose of from homeopathic medicine to everyone, and they reported that it is curing it. Since ages, sir, in South India, this karpura, the edible karpura, being added in laddu, halwa, and other kheers in South Indian recipes. In Tirupati Balaji, the main prasadam, the laddu, being added with this flavored by this campura dose. And they believe that the lung infections, the abdominal disease will be recovered. The homeopathic medicine came into this existence that campura edible cure or to safeguard the COVID-19 infection. We did one experiment, sir. We made a hand sanitizer and we made almost 40 to 60 liters of this. We're distributing free of cost to everyone. Our target is police people who are struggling for us on the roadside. We're giving free sanitizing to them. The story behind this, because I know that camphor is going to help out everywhere. The ingredient what we use is aloe vera, eucalyptus, azadirachta, neem, puja. Puja is well known for antiviral drugs, but we added camphor in this. The camphor lavender aromatic oil, the tea tree oil, the eucalyptus, the Nilgiri leaf, and neem. This has shown a wonderful result. The Kaibos is a Persian word, which means that complete eradication. This is formulated by us. We are sent for patent and we are kept the paper for publishing. The second one is Tejaswani. Tejaswani hand sanitizer is purely Tejpata, bay leaf, your dalchini powder and camphor. A little 30 to 20% of isopropyl alcohol. Ethyl alcohol is 5%. Distilled water is less. But this is a magical performance of this. The result is this. You can see where the 3 number is. You can find that they will have a PPT box on it. The zone of inhibition of sterilium. The zone of inhibition is ready-made product from soap distillery, that is Genius, and the two drugs, which is Tejaswani hand sanitizer and Kaibos hand sanitizer, have shown dramatically a great achievement against Klebsiella and Pseudomonas. The zone of inhibition of sterilium is 1.75. The Genius was 2.3, but our hand sanitizer, this is Tejaswani and Kaibos, added with camphora, edible camphora, and you can see it is 2.5 centimeter for 3 days you observe. It shows the Siddle effect of bacteria, that bacterial Siddle effect, whereas the marketed one has shown the static effect. This is what we got remarkable results, and the homeopathic medicine into the market, camphora 1M dose, which is I also recommend camphora must be tried. And if you have edible camphora, make any sweet halwa or laddu or burfi, add that edible camphora in 1 kg, 1 gram of the dose, mix it well and eat it 5. That is going to suffice your upper respiratory tract infection protection. Daily, routinely, we and my colony mates are doing it. The puja kapoors are spread over the rooms It is a very good sanitizer. It supplements, and this aerosols going to kill the bacteria. But it's a virus. I hope the August gathering who is on online, they might be thinking that Dr. Ganesh is discussing about the bacteria and we are talking about the virus. This puja with the combination of Kampura, the Kapoor, what we call, is going to act against viruses because so many positive cases has been taken this dose and has shown the temperature depletion. Recovery rate is fast and the immunity is also enhancing. Instead of 10 days, 15 days, the recovery in 5 days, 10 days. So we had subjected for our international project already submitted. We are waiting to fund by them. And we sent for the filing the patent also. The reference recently, Russian 2014, they published that camphora based diamines are inevitable for viruses, influenza viruses. The reproduction rate being reduced. It is long back, 2014, 5 years back, 6 years back, already reported. And now the homeopathic medicine in the market. I feel immunotherapy is one of the best we must take. And but not of the least, but the art of what I told, eliminate your wheat. The gluten is going to kill your immunity. The gluten is going to kill your beta cells of pancreatic organ. The gluten going to kill the villi and crypts proliferation. What ATA combination we had noted down. If you want to know it again, I'll tell you. It is 250 gram of rice, 200 kg of deshi chana, 200 ग्राम ज्वार बाजरा मक्का रागी, 20 ग्राम आपका सौंठ, 25-25 ग्राम जीरा सौंफ और मेथी दाना रोस्ट कर ले, अलसी 100 से 150 ग्राम उसको भी रोस्ट कर ले, आटा बना के 2-3 चपाती काफी, जिनको फीवर हो रहा है, जिनको लंग इन्फेक्शन है, प्लीज ये ले लें. और जो मैंने डिकॉशन बोला था दैट मस्ट बी टेकन. Thank you for the patience listening. I'm thankful to the Moga ISFS committee members. The focusing theme was COVID-19, the role, and thankful to Dr. Gupta, G.D. Gupta sahab, who invited me as a resource person. I'm thankful to the chairman of this institute. I'm thankful to especially Amit, Saurabh, and Pratik, who had really worked hard to connect me with you all. And any query, my number is so easy. It is 98263 21616. I'll repeat it. It's 98263 21616. If you want to know about the herbal decoction formulation, I'll disclose because already we got a primary patent for this. Properly and namaskar, dhanyawad. Any query, please, you can ask.
Yeah, thank you, Dr. N. Ganesh sir, for your valuable talk. And I hope that all the viewers and the participants is going to be benefited with your talk. Thanks a lot, sir. Thank you.
Yeah, thank you. Namaste.
Okay, thank you. So all the participants here, we are going to end up with today's sessions, and certificates for all the viewers and the participants will be sent, but certificate will be given to only those persons, those who got registered in the conference. So thanks a lot. Stay home, stay safe, keep in touch. let me do the setup for the live. Yeah, sir. So, sir, I'm going to start. So, today we are going to start another session, and we have a very renowned person with us, Dr. M.M. Gupta, presently working as Associate Professor, Senior Lecturer in Pharmaceutics at School of Pharmacy, Faculty of Medical Science, the University of the West Indies, St. Austin, Trinidad and Tobago, North America. He worked as Chairman of Research Committee of School of Pharmacy, Faculty of Medical Science, the University of West Indies, and he developed a laboratory of pharmaceutical formulation development and design in the School of Pharmacy, Faculty of Science, the University of the West Indies, St. Austin, and Trinidad and Tobago. Before Dr. Gupta has worked as professor and principal, associate professor, and head lecturer in India. By qualification, Dr. Gupta is BPharm, MPharm in pharmaceutics, and the PhD in pharmaceutical sciences. He also did MBA as well as the postgraduate certificate in university teaching and learning from University of the West Indies. Dr. Gupta is a fellow member of Indian Chemical Society, Indian Association of Pharmaceutical Sciences and Technologies, and other organizations like Association of Advanced Biodiversity Sciences. Dr. Gupta is having a teaching experience of 19 years for graduate, postgraduate students at national and international level. He has supervised more than 16 MCOM students, 3 PhD students, and presently he is supervising 2 PhD students at the University of West Indies. Welcome you, sir. Hello.
Yeah, can you hear me? Hello.
Dr. Gupta. Dr. Gupta?
Yeah.
Yeah. Sir, so hand over to you.
Okay, good evening, everybody. Can you hear me? My voice
Yes,
is
sir.
audible? Okay, and my picture is
Yeah,
audible.
loud
Okay.
and clear.
Okay. So, good evening, colleagues. Good evening, my health professional people. And my pleasure to present here about community pharmacists in the COVID-19 outbreak. And before this, I would like to thank Professor G.D. Gupta, sir, for inviting me to deliver the lecture on this COVID-19 related matter. So, colleagues, today I'll discuss about the what is the role of the community pharmacist and what are the challenges for the community pharmacists during this COVID-19. Everybody talking about the different healthcare professionals, nurses, doctors, pharmacists. But today I'll let you know what are the challenges for the community pharmacists, those are working as a retail pharmacist in different medical stores and drug stores, even sometime in the hospital also. So I'll give some little bit information about this challenges for the community pharmacists. A lot of information you will see is in the public domain. This is my declaration. Even I mentioned some acknowledgement in the last of my slide. So, the community pharmacists, actually in India generally think only the pharmacists, but in the European country, in American country, there are different type of pharmacists. One of these is a community pharmacist. And what are the community pharmacists? Basically, those are working in a community like retail pharmacies or in different drug stores. So the community pharmacy is basically the vital part of the healthcare system. They are, other than doctors and nurses and other healthcare professionals, this community pharmacy is also very important part of the healthcare system. And you can see also this community pharmacy is also frontline warrior during this COVID-19. And they are like dispensing the medicines, they are giving the medicine to the senior citizen, all these peoples. And you can say this is the first person to be in contact with the people in relation to the questions pertaining to the healthcare services concern and medications. What happens like if somebody is having like any problem like maybe cough or fever or maybe any problem. A general concept phenomena is somebody is having the mild symptoms. First, the person will go to the drug store or medical store or community pharmacist. and he will go and ask, because you can say the pharmacist is sometimes we call it a first line healthcare professionals. In case of severe problem, definitely he will go to hospital, but sometime a little problem or mild symptom, definitely first he will go and ask to the pharmacist, and they sometimes ask some different type of the questions whether this is okay for me or not. So during this coronavirus situation or the pandemic, or you can say the COVID-19 problem, what is the role of this community pharmacists? I'm not talking about the only hospital pharmacy, I'm talking about the community pharmacists. The first important part of the community pharmacy is government is giving a lot of information, NGOs are giving a lot of information, hospital is giving a lot of information. But what the community pharmacists can do? The community pharmacists can educate the people and inform them about the prevention and control of this coronavirus. You can provide informations, what is this, what are the suspected symptoms. And second is the role is precautionary measure to be taken and means to prevent the community transmission. Like a mild symptom person is coming to the pharmacy. So pharmacists can provide some precautionary measures, you should clean your hand, you should wash your hand when you are going to touch any surface, or all these type of the precautionary measures, you should put the mask, how to put the mask, all these things the pharmacist can provide information. What are the other important rule? Because right now in the lockdown conditions, and because of that, even the government especially circulate this, you can say, advisory. Those are the elderly patients, those are the senior citizens, should not go outside. So what the community pharmacists can do, the concept here, even in European country, American country, even I think in India also, what the community pharmacists can do, they can fill out the prescription in advance and provide an emergency medical supply for at least 30 days, for 1 month. Sometimes what happens, the patient is coming every week or maybe every 10 days or every alternate day. No, as a community pharmacist, what you can do, a person on the regular treatment of diabetes or the heart problem, you can tell them, or what you can do, or sometimes the caregiver is coming to receive the medicines. As a community pharmacist, what you can do, you can supply at least the medicine for 30 days if you are having the valid prescription, or the caregiver is coming with the valid prescriptions. Another important rule, because we are also in the chain supply of the drugs. So as a community pharmacist, you can make sure there's a smooth flow of drug by managing the stocks. And this is a duty of the community pharmacy also, you are running a medical store or you are working as a community pharmacist. You have to be regularly check, we call it the inventory control. You have to carefully see whether stock is properly maintained or not, is sufficient or not. If you are not going to maintain, you are not looking at the proper inventory. It could be possible that maybe you are having diabetic drugs today, but maybe tomorrow somebody is reaching to your pharmacy, but you are not having the diabetic medicines. In that particular periphery, you are your pharmacy in particular area, and you are only one person who is supplying the diabetic medicines, because you are not having the proper inventory. And when the person will come, you will say, I am not having all the diabetic drug because these are the out of stock. So this is your duty. In present situation, you have to manage, you have to see, you have to check inventory, whether you are having a sufficient amount of drugs. Otherwise, it could be possible that the person who is required the medicine and in your periphery definitely will suffer, or maybe the person has to reach in another pharmacy which is far from his or her place. So as a community pharmacist, you have to maintain a smooth flow of the drugs by the inventory control. As per the stock in hand, a community pharmacist will try to fill out the prescription for the maximum number of days. In the earlier slide, I had mentioned that at least 30 days. But if possible, with a valid prescription, you can also provide medicine for the more than 1 month. and especially for the senior citizens, especially for the vulnerable disease patients. You should not wait the person will come or maybe every week you will supply. No. During this present COVID-19 crisis, adjustment in pharmacy operations also required. I'm not talking about the only timing of the pharmacy. That is the other part. But I'm talking about the, for example, asking the prospective customer means patients to call in regard to refill, renewal, or available drugs and emergency supply. General concept in these countries, what is the process actually? The the caregiver patient is having prescription and doctor is prescribing a drug like for sometimes 6 months for 1 year. Once the person will reach at a pharmacy store, even though caregiver and patient is having the medicine for the 6 month 1 year, pharmacy will not supply for the entire 6 month 1 year. The system is like every month the patient and caregiver have to submit the prescription to the community pharmacy or hospital pharmacist. They will supply for the 1 month only, and in that same prescription they will write remaining 11, like a prescription for the 1 year. They will write 11 refilling is still remaining. They'll write by the red pen. Next month again the patient or maybe caregiver will come and they will produce the same prescription, and patient can receive the medicine for the next month. This is the system actually. Even sometime, like in case of the sometime if you want to receive the drug not from the hospital, from your community pharmacy, sometime pharmacist want to keep the original prescription with him. He will inform you once your drugs maybe like you are going to receive for 1 month drugs, maybe after 25 days you can go and you can just ask him about the next month prescription, next month drugs. Based on your data on the computer system, they will provide next month medicines. So what you can do in present COVID-19 crisis, you can inform to the patients, not wait for the especially senior citizen and vulnerable patients, and you can provide medicine because you are having the data in your computer system. Moreover, it is important to actively reach out to the susceptible patient in need of any assistance. This is a duty of the pharmacy also. That's why we call pharmacies is a vital part of the healthcare system. But what are the risks? You are working as a community pharmacist, like you are having drug store or medical store or any like outlet, like a pharmacy outlet. What are the challenges actually? The first challenge is definitely you are as a pharmacy, you are working for the long hour in a setup of the any setup where the chances of the COVID-19 exposure. You don't know the person who is coming is a COVID-19 patient, not maybe asymptomatic. So first challenge is you are working for the long hour in a pharmacy, maybe sometime 8 hours, 6 hours, and you are coming in contact with the person who is maybe asymptomatic or symptomatic. At a risk of the exposure to the COVID-19 through the infected person with or without the symptoms. This is an important part. If the person is having symptoms, definitely after the testing, definitely the government or maybe hospital may put the person in a quarantine or maybe in hospital. But in case of the person is asymptomatic, the chance of the exposure or chance of the infection to you also as a community pharmacist. Third thing, definitely in the pharmacy, patient will submit the prescription to you. You will fill the prescription, you will supply to medicines or dispense to the medicine to the patient. So during the filling the prescription, dispensing the medicine, the chances of exposure of the potential patient with the COVID-19, because you are receiving the paper. You are not receiving like a soft copy, or definitely you are having the hard copy, patient is giving the prescription to you. And definitely you will receive on the paper is possible the chance of the virus. And after filling the prescription, definitely return back to the prescription with the medicines. So this is another chance that this might be possible that this exposure with the COVID-19 or maybe the coronavirus. So what a community pharmacist can do? Like you are running a medical store or drug store, The first important thing, even though all the NGOs and government organizations and time to time different organizations, they are also providing information about the COVID-19 symptoms or mild symptom, what are the possible symptoms. But in your community pharmacy, you should also put some posters. You can display some different posters about the COVID-19 symptoms, some information about the COVID-19. So when the patient will enter in a pharmacy, he or she can read all this information. You should provide all the, even verbally also, but you should also display some poster also in your pharmacy. And where? At a place where person can easily see the information. And information must be in a manner so they can easily read it. It should not be very complicated, like a complicated language. A layman who is coming in a pharmacy must be immediately understand what is a basic symptom of COVID-19. So first thing you can do. Second thing, maybe you are having the big pharmacy and there are more than 5 people and 6 pharmacies or 8 pharmacies are there. So what you can do as a chief pharmacist or maybe the owner of the pharmacy, you should inform, or maybe staff member should be encouraged to maintain a social distance at least 1 to 2 meter. It's a guideline by the WHO also, even different organization, health organization also. From the prospective symptomatic and asymptomatic patients. Even nowadays in a different pharmacy, they are putting in sometimes the glass barrier or the plastic barrier and between this patient and the pharmacist. But at least 1 to 2 meter distance there, you can say that how the person will submit a prescription. I'm talking about a staff member, they should maintain the distance at least 1 to 2 meter. Person will submit a prescription, you can put the barrier or the plastic barrier, the glass barrier at your counter. Third thing, even this is now routine practice, even now that people are carry with the sanitizer. But you can, because you are working as a pharmacist, healthcare professional, you know all these things. So what you can do at an entry point in your pharmacy, just like a patient is going to enter in your shop, entry point of your medical store or in a pharmacy, you can put the alcohol-based hand sanitizers. They should be placed at a key point while entering the pharmacies. Another custom right now, I saw even a lot of places also, even grocery stores also, they put some like a outside water and soup and they are putting the information that before entering you should clean your hand, proper wash. You can also do that one, but you should also put the alcohol-based hand sanitizer at the entry point. Next is a automatic refilling system. Should be established for the ease in a delivery of the drugs to the patient without waiting in the line and exposing themselves in the vicinity of other patients. What is the custom in the hospital also, even a community pharmacies also, like at a one time there are 5 patients or 7 patients or 10 patients. If you are having the record of the person who is frequently visit your pharmacy, and especially for the diabetic patient or heart patient or other vulnerable disease, and patient in the line. So what you can do as a community pharmacist, you have the record, you can identify the person by the help of the ID card, you can provide information to the patient, don't stand in the queue or line, you can sit here or maybe a particular waiting area, and then you can automatically refilling and you can dispense the medicine. So because of this, there will be less crowd and definitely social distancing also, and there's a almost negligible expose themselves, because now they, like there are 6 patients or you are having a record of the 4 patients, you can tell them, you can sit, so definitely there will now 2 patients in the queue. If you are having the data of the patient in your system, then you can fill the automatic refilling. If you are not having, then definitely patient has to stand in the queue, that time you can provide information, at least keep a distance, at least 1 meter. But if you are having the data, if you are having the automatic refilling system, better to fill prescription and provide the medicines to the patients. Community pharmacists should refrain from the touching the, this is a common actually. Everywhere the people are saying whenever you are going to touch any metal surface or surface, don't touch your eyes and mouth and nose. If you want to touch, you can wash your hand at least 20 seconds, then you can. Because even a lot of study I saw, as a routine practice, a person more than 20 times in an hour they are touching the face. So as a community pharmacist, not only you can also provide information to the patients and those are coming in your pharmacy, sometimes caregiver also, that don't touch your face. If you want to touch your face, better to sanitize first, then touch the face. Yes, all the community pharmacists should be trained to adhere the CDC standard, that is a common disease control standards and transmission based on the precautions, especially for the susceptible COVID-19 cases. There must be training to the all pharmacists, and why it is required, how to dispense the medicines, how to receive the prescription, how to put the gloves, how to put the PPE, all the information, because the pharmacist is also part of the healthcare system and they are coming directly in contact with the patient because they are dispensing, they are working in a pharmacy. So all the community pharmacists should be trained to adhere to all the CDC standards and transmission based on the precautions, especially with the susceptible COVID-19 cases. Community pharmacists should be able to put the personal protective equipment and trained to identify the proper gear. Everybody talking about this PPE, but if you are working in a community pharmacist, if you think there's a more exposure with the COVID-19 patients or asymptomatic patient, or there's a chances, it's better to put the PPE. But there must be training how to put the PPE. Pharmacists should know. Even sometimes health organization and government organization is providing information and giving the training to the people. And this is also compulsory. This also compulsory to put the mask for the general people or general populations or laymen. But for the healthcare professionals, healthcare people like you are pharmacists, you people pharmacists, healthcare professionals. So what you can do, you can put the N95 face mask that is approved by the National Institute for the Occupational Safety and Health. If needed, they can put the shield and goggles also. It's also better to put shield and goggles because when the patient is coming, they will provide a prescription to you. You are coming sometime in a contact less than 1 meter distance. So better to put the shield and goggles. So there will be less chance, or like a person is going to speak you, there's a less chance if the person going to speak spreading or the chances of the droplet transmission, because you are having the shield in front of you or goggles also. Just I am giving this information. When you are working as a pharmacist, you are having the PPE, you are having the shield, you are having the goggles, all things. But just giving some this information to you by the help of pictures, how to put the gloves. Is required for the pharmacist. You can see in all the pictures, and this is in the public domain also. Just I took the picture from the public domain. I also give the acknowledgement to the person. So you can see here how to remove the this gloves. Once putting the gloves, you can see in the picture 1 how the person is going to remove the first one. Pinch and hold the gloves from the outside near to the wrist area. Then what the person is going to do? Peel downwards away from the wrist and glove inside out. And third one, pull the glove away until it is removed from the hand, holding inside out gloves with the glove head. First one remove. Now carefully see the fourth one. Don't touch now your hand on the outside of the gloves, because outside gloves already it might be possible the virus or maybe any bacteria is there. So now you can see in the fourth picture, put your finger inside the second glove, not put your hand outside the gloves. With your ungloved hand, slide your finger under the wrist of the remaining glove, and I put don't touch the outer surface of the glove. If you are putting, then definitely you are itself you are going to expose your the ungloved hand with the micro of the virus. And now peel downward away from the wrist, turning the glove inside out, and continue to pull the glove down and cover inside out gloves and being held in our gloves hands. So this is a basic information, and being a pharmacist, because you are daily you are wearing the gloves and the PP on the goggles, all these things, but the basic things. So in conclusion, what I can say, definitely like other healthcare professionals, pharmacists also playing a crucial role in COVID-19 pandemic. We are coming in the contact with the symptomatic patient or asymptomatic patients. So definitely is an important part.
डॉक्टर मदन जी,
Yes, sir.
आपके यहाँ से आप स्लाइड है, फर्स्ट स्लाइड है कि आगे आप स्क्रॉल?
You would have tell me, because almost is finished my lecture. Anyway, no problem. I was thinking that everybody is able to see that all the slide. Okay, no problem. Just okay. I just explained about the community pharmacies. Maybe you heard about this one, and then I mentioned about the role of COVID-19. What the role of, now you can see my slides.
Yeah.
Okay. Okay, then okay. So actually, I was explaining this how to your put the gloves, how you can ungloves. Now you can see the picture. Yes. So what I was explaining you, once you are putting your gloves, how you can to remove, how you can remove your gloves. You can carefully see. If you want to remove, first one, pinch and hold the outside of the gloves near the wrist area, and second one, put the downward away from the wrist. The important part in the picture, you can see, first your hand is ungloved. Don't touch your ungloved hand on the outside of the glove. You can see with your ungloved hand, put your finger inside the glove. Don't touch the outer surface of glove. If you are putting outer surface of the glove, definitely you are exposing your hand to the virus or bacteria. So this is the, and then you can pull and you can remove the gloves. So in the conclusion, what I was explaining, sorry, actually, I was not aware that nobody was looking my slide. So conclusion, actually, I was explaining the community pharmacy is a very important part of the healthcare system, and definitely you should take care. You should take all the precautionary measures while you are dispensing, while you are receiving the prescriptions. Community pharmacy is always at the risk of the contact to the virus. However, the proper hand hygiene with the added layer of protection. What are the added layer of protection? You should put your gloves, If required, you can put the face shield, you can put some goggles, you can put the N95 respirator or mask or isolation gloves. You can warn and you can keep themselves and their patient safety. So colleagues, actually overall I want to say the community pharmacies, the important first part is in your pharmacy, display the information, basic information about the COVID-19 in a simple language. So the layman who is coming, entering in your pharmacy must understand what is a COVID-19. Second thing is whenever you are receiving the prescription or you are dispensing the medicines, better to keep the distance. Third thing is when the patient is a vulnerable patient is a senior citizens, better to dispense the medicine for the 1 month at least. Or if you are having the automatic refilling system, you are having the data of the person who is frequently visit your pharmacy. So you can, what you can do, you can automatically refill and you can dispense the medicine. My mean is, what the meaning of this is, like in a pharmacy, there are at a one time 10 patients. But out of 10 patients, you are having the record of the seven patients or 6 patients. So better to tell all the 6 patients that sit at a waiting area, you can automatically refill and you can dispense the medicine.